Our next session, welcome. Welcome to this session. We are going to be looking at ethical principles, still under the introductions to foundation of midwifery. So as we started introducing, this is part of what we already talked about, and I'm still the same presenter. So when we talk about ethical or ethics, ethics basically talks of that moral principles which is supposed to guide one's behavior in their field of profession. So now that we are looking at ethical principles in midwifery, basically we want to look at those behaviors or those moral principles which are going to guide you so that you're able to follow the standards or standard guidelines according to midwifery practice. So one of the ethical principles is autonomy. Autonomy means respecting the woman's right to make decision about her care. So as a midwife, you are supposed to be autonomous. That means whatever the woman decides is what you are supposed to respect. But after, there are some there are some rights which you cannot accept, but after you have explained and the person still insists on the right that you think is it might not be helpful or healthful to them, you can document them so that you are on a safe side legally. Then the next ethical principle is beneficency. This is acting in the best interest of the mother and the baby. So whatever you do for the mother and for the baby, it should be for their better health and not for your own benefit. Then we have the third one being non-maleficence, which means avoid harming during provision of care, or some people call it do no harm. So we also apply this principle in midwifery because in most cases we are faced with situations that might involve you doing harm. For example, midwives are very known for slapping the mothers. So the ethical principles is telling you that you should do no harm to the mothers during your provision of care. Then justice, which means fair distribution of resources and equal access of care. So all the mothers that you will be under your care, you are supposed to treat them equally with fairness and justice. The next ethical principle is informed consent. So ensuring the woman understands the risk, the benefit, and alternative, respecting her right to refuse or withdraw consent. So when we talk of informed consent, there are some procedures, actually most procedures that for us midwives are encounter. So you are supposed to always carry this particular ethical principle everywhere, making sure that before you allow the mother to consent, you have explained for them the risk, you have explained for them the benefits and other alternatives, such that you leave them with the right to either accept, to consent, or to refuse, or even withdraw after consenting. So that is their right. Then the next ethical principle is confidentiality and privacy. So, as a midwife, safeguarding the mother's personal information is very crucial. So, as we all know, uh, they already trusted the midwives who trusted you as a midwife in the beginning by telling their all detailed information to you health wise. So you should safeguard whatever personal information they have told you. If they said nobody should be told, including the husband, including the family or the relatives, you have no right to share what she does not want you to share. Privacy considerations during examination and consultations. So as a midwife, knowing fully well the people we are handling, they are the mothers of the generation, whether it being they are still young people or they are old, but we cannot expose whatever we are doing. So every time you are examining a woman, it should be in a well guarded, well secured place that people are not able to see whatever you are examining. So make sure there is privacy, or you see them in a room which is safe for them. Sharing information on only on a need to know basis. So still on confidentiality and privacy, there are some informations which even if the person might not want you to tell the family members, but you can share with your colleague at work only if you're giving reports, or even if you feel that the condition is way beyond your care, like you cannot handle it, you as you. That's when you can share the information with another health worker. So you share information only on a need to know basis. The next ethical issues. So we have finished the ethical principles, and now we want to look at ethical issues. So the ethical issues are like when we talk of issues, most times we look at maybe like problems that can arise because of the ethical principles. So one of the ethical issues or ethical problems in midwifery is conflict of interest in midwifery practice. So by this, you are supposed to ensure decisions are based on the woman's best interest, not personal gains. So sometimes we tend to ignore the ethical issues, or you feel like whatever the person has discussed with you, you need to share with somebody, then you leave alone part of the ethical principle which talks of confidentiality and privacy. So by that, you are ignoring, or you're bringing conflicts of interest in midwifery practice by sharing what the person told you not to share, because it's for your personal gain. Transparency and disclosure of potential conflicts. So there should be transparency and disclosure of potential conflicts. If you have conflicts, sometimes because you're a health worker, you might find that one of your enemies will be your client or your patient. And you feel that if you feel that you cannot be in position to keep whatever or to work on that person, can be transparent, and then you disclose so that there is no ethical problems. Allocating limited resources can also be an ethical problem. Much as we say they should all receive equal care. So balancing the needs between the women, individual women with available resources is what we are supposed to do by making sure we advocate for equitable distribution of resources. So this can make us to have ethical issues if whatever resources we have is not enough to be equally distributed among the women who are under our care. Medical errors and disclosure. Recognizing and addressing medical errors in midwifery care. So in most cases, if you have identified a medical error with one of your colleagues, let's say a mother has come, and then before even you ask the person's name, let's say this person came in labor, you take the person. The mother came and she looks like she's in labor. Without asking the name, without asking whether she was referred, you immediately take the person to to the labor suit and begins to examine. You're examining a person you do not know. Even you do not know the name, you don't know whether she was referred or not. So that is one of the medical errors that people do. If you identified something like that with your colleagues, you make sure that you address such so that the next time they will not fall into problems. Emerging technologies. So with all the technologies that has come up, others are being misused. So balancing the benefit, the risk, and the privacy is what you are supposed to take into consideration. So whatever technological or technology that you intend to use during providing care, you should make sure that the benefits, the risk are all laid out. You tell the mother that if I do this and this with this, this and this is what you're going to benefit, but also this might be the risk that you're able to face. Vulnerable populations. One of the ethical issues is you are supposed to know the people in the population who are vulnerable. One, pregnant adolescents, refugees, then marginalized communities. So those people are they are in the group of special needs. That means how you are supposed to handle them you should even be more careful than when you're handling other people, by making sure that physically, emotionally, their needs are taken care of. So through doing that, you can ensure equitable access to quality care and addressing social determinants of health. That's how you can take care of people who are from the vulnerable population. Then you should also there is cultural sensitivity. One of the ethical issues or problems is cultural sensitivity. Midwives work with women from diverse cultural backgrounds and respect their beliefs and practice. So, as you're going to be continuing to do your midwifery practice, you should know that you should have diverse cultural backgrounds. That's why we do record the tribes of the mothers. So if you want to ask even up to the clan, you can do, so that you know that in this clan or in this tribe, this and this is not acceptable, or this person might behave like this and this and this. So that helps you to put your ethical principles on check. Cultural sensitivity involves understanding and appreciating cultural norms, traditions, and preferences. So that means we are going to have very many people under our watch coming from different cultural backgrounds and norms. Midwives adapt their care, adapt their care to be culturally appreciated, fostering trust and promoting effective communication with women and their families. So by doing that, you know the diverse cultural backgrounds of the people you are taking care of. Then other ethical issues are ethical dilemmas in the end of time care for mothers and newborn. So this is a challenge in most cases, not only in midwifery, but if we are having people who are under our care and they are in their end of life care or stage, you find that it's difficult for you to maintain ethical issues, but still you are supposed to make sure that the ethical principles are still well guarded and you're performing them well. So palliative care, life-sustaining interventions, and withdrawal of care. People under palliative care, people who are on life-sustaining interventions, like maybe they're in ICU, people who are on withdrawal of care, maybe they've been using drugs and now she's pregnant, something like that, or somebody who has been mentally ill now got pregnant. Involvement of ethics committees and interdisciplinary team. So the dilemmas will come when you're faced with such people and you need to still maintain your ethical principles. So what you need to do, you involve other interdisciplinary teams basing on whatever the person is suffering or undergoing. Then we have reproductive rights, advocating for reproductive rights and autonomy, ensuring access to family planning, contraceptions, and safe abortion services, supporting women's choice regarding childbirth and reproductive health. So those are reproductive rights that you as a midwife should make sure that you advocate for them. Integrity and professionalism. So upholding right standards of professionalism and ethical behaviors is what a midwife is supposed to do. Maintaining honesty, integrity, and accountability. It's just like a characteristic that you should have to make sure that the ethical principles are in order. Reporting any concerns or unethical practice. Then we have the patient's rights. Respecting the women, we might not call them patients. Yes, they're not our patients, but they are our clients, but they still have the rights of the patient. So respecting the woman's right to dignity, privacy, and respect is what you're supposed to do as a midwife or as a professional. Ensuring access to comprehensive and unbiased information. So you make sure that you have unbiased information. Whatever information you give the mothers is the one they are supposed to receive without any biasness. Promoting shared decision making and the rights to refuse treatment. You're supposed to make sure they know that if they are not willing to take a particular treatment or the route of administration of particular drug and they opt for another one, they are aware that they have right to refuse. So that is all when it comes to issues of ethics, and we shall be continuing from there.